Hello, everyone, and thank you for joining our show today. But first, please like, share, and subscribe, and hit the notification bell on YouTube so you'll know when we release a new show. Also, leave us a comment and let us know how we're doing. Welcome, Franchesca, to our second episode of Bright Star Care Connections.
Hi, Becky. It's exciting to have our second episode, and I'm super excited about our topic today.
Yes, today we're going to be discussing family dynamics in healthcare.
Awesome.
Yes.
And I think looking at the family dynamics, the importance of communication from the very beginning, but the idea that when you start to deal with family dynamics and just healthcare issues and crises, it's so important to communicate and to be able to accept that feeling, recognize where you're at, because so many times you feel like you're in a maze.
Yes.
And that maze can be so confusing and so emotional.
Very true. So, as we talked about last time, and we're going to reiterate it this time, our main message is plan, plan, plan. So, we always say plan now, so you don't have to worry about it when the time comes. So,
Exactly.
yes.
Exactly.
Plan ahead.
Yep. And at that very beginning of your planning stage, when you start to recognize the situation is developing, let that communication start early.
Right. And so, we have those scenarios where you have a family and, it's a mom and dad and 3 or 4 siblings, and they all get along and they're all great and they all live together or
Life
in the
is
same,
good.
same community. They're all on the same page, and mom and dad have made a plan, and it's great. And there's no issues and everybody's happy.
And everybody's best friends.
Yes, but that is few and far between, as we come to see.
Right.
And so a lot of times what we've discovered is there's situations where it might be a blended family. We have families where, mom or dad have been married for 50 years and mom passes away and dad gets remarried, and now there's a stepmom and step siblings involved. And so what used to just be care that you were worrying about for your own parents is now involving a whole other family that you may not know really well.
Right. Or maybe you do know them well, but you don't like them.
And you don't get along, and you have different ways.
Difference of opinions
Yes.
and ways of handling life. Life happens, and everybody wants to do something different.
Yes. And even in families where there isn't a blended family, a lot of times there's siblings that do not see eye to eye, and they don't agree with each other, and they don't get along.
Right? Or they're far. You have people out of state, out of the country. Some only talk to mom by phone, and everything is always wonderful,
Right.
dandy. But the one who's right there in person can see the changes, the decline, and is most often dealing with the hardship.
Very true. So today we're going to talk about some tips and tricks for getting started when there are some not as perfect family dynamics in healthcare. And even if they are perfect, no matter what situation you're dealing with, it's really important. These tips work for everybody. And as you alluded to earlier, our very first thing is open communication. So talk to me about that.
So being able to really start your communication early, that's one of the things. I think what we find, and we've talked about this over and over, is a lot of times when we get a phone call when someone's in the middle of a crisis. And it's usually the person who's most involved or closest to the family member who is having the trouble, whether it's mom or dad, and they're dealing with memory issues or their bills aren't being paid. And that person is dealing with everything and doesn't know what to do. They're caught in this maze and they're trying to figure out how to navigate. So starting to communicate early on when you start to see things come up, trying to identify who should be involved in your communication. Do you obviously want to talk to mom or dad and try to see, mom, dad, do you recognize what's going on?
Right.
But also, are the siblings involved? Who's involved every day? What kind of role are people going to have? Set up a meeting.
Yes, we really like the idea of having meetings with a clear agenda going in and everyone checking their egos at the door.
That's right. Remembering that it's not about us, it's about mom. Everybody is coming into the picture to see how we can give mom or dad or whoever that person is the best quality of life and help them to live a dignified life.
Right. And to assume that everyone has the best of intentions.
Exactly. That's important. Because I think you're right. So many times someone will walk in and feel like, one, they might know better, or two, like, no, nobody knows what they're doing.
Right.
But don't be afraid to communicate. Recognize what we're feeling, if we're coming to the table and we don't know how we feel about something, or we just don't have enough information, write down questions. Be prepared with questions, ideas, and really the idea that you're going to be sensitive to everyone who is there, everyone who's present.
Yes, yes. And active listening. So I know that all of us are guilty of this, and it's listening so that you can respond instead of listening so you can learn. And so, when you're sitting in those meetings, take a minute and think back to, what are we really trying to achieve here? What are we trying to accomplish? What's the best course of action? Listen to what your sibling, your parent. Don't just listen so you can respond. Listen so that you can really get a better understanding. And our second tip is defining clear roles and responsibilities.
Right.
What does that look like?
So I think when you're getting together and you're all, some of us are going to be so busy. Some people are working full-time jobs. Maybe there's a daughter. One of the daughters is a stay-at-home mom, and everybody has different availability, different strengths, different ways of handling things. So finding out who's going to spend the time with mom, take her to the doctor, take her to the pharmacy. Does mom need someone to take her to the doctor or to the pharmacy? Someone who could maybe look into home care, maybe call Bright Star and ask, what options and what services can be provided. Who is going to do the grocery shopping? Contact some professionals for more information. And who's going to do what part of the research?
Right. And I think it's really a good idea to divide roles up. So like you said, one person, might be in charge of doctor's appointments. Another person might handle the finances. Another person, might do the grocery shopping, but also dividing up the care, on, this is my week and I'm going to be with mom, 6 hours this week and next week is your week and dividing that up.
Yeah, making sure that everybody has time to take a break.
Yes.
Covering, does mom need someone at night? I know we've had situations in our family where we've all had to take turns.
Yes.
Mom, I'd get the weekends because I was always working. Mom would do the overnights because she was retired. So we all had a role to play.
Exactly. And one of the things we think is super important is to have an actual written plan. So we all know, we've been to meetings, we've walked out, we all think we've heard one thing, and at the end of it, somebody goes back and says, I never said that.
That wasn't the plan.
Right. It just happened to me today. So I think it's really important to, after you guys have a meeting, to write out the plan and send it to everybody and have everybody agree.
Right. I love the idea, and I think you're the one who was saying this. Have a text message or maybe WhatsApp or some sort of communication where everybody is included, nobody's left out, so that nobody feels bad, everybody's on the same page, and nobody wants to get caught, but you can always go back and say, well, here's where we talked about it, but let's figure it out now.
Right.
And don't being really sensitive to everyone, because the stress of dealing with a situation where mom and dad aren't well and you're trying to figure stuff out while you're raising children, while you're working full time, and if you own a business, it's even tougher because you have this added responsibility. So being sensitive to everybody's role and being able to kind of jump in and help. People are going to get sick once in a while.
Yes.
They're going to have family crisis. I might have a situation at home that doesn't allow me to go ahead and do the shopping today.
Right.
So it's being sensitive to where we are, and if we can't do something, communicate.
Yes. And that goes into being flexible. Because things happen, plans change, people's condition change. So, maybe mom is able to do a lot more now, and in 6 months from now, she might decline, and you're going to have to change the plan.
Yeah.
And everyone's going to be flexible, or your own situation can change.
Right.
Maybe you have a job change, or you get sick, or one of your kids gets sick, and you no longer can help out as much. And being flexible and having other people help and step in is also critical.
Absolutely.
And then establishing boundaries.
Yes.
This is a big one.
This is important. I think we all are guilty of trying to do too much, trying to do too many things, and establishing boundaries and respecting personal time is very important. Making sure that we're taking care of ourselves. What do they say? If you don't take care of yourself, you're no good for anybody else. Right. And so making sure that we're functioning at our very best and honoring the rest of our family.
Yes.
And making sure they're taking care of themselves and having some personal time.
And with setting boundaries, even things like hey, listen, we need to communicate. We've all been in those text change where your phone is going off every 30 seconds. And so maybe the boundary is we're going to communicate at the end of every day, unless it's an emergency, or we're going to communicate once a week. So people do not feel like they constantly have to be on their phone and checking messages. And maybe one sibling doesn't need to know every single detail, where another one might need to know everything. So that's an example of setting a boundary of how much you want to be involved and what that looks like for you. And respecting those limits.
I agree.
When somebody sets them and says, I've got a really busy job and I can't have my phone going off every 30 seconds. Respect that for them.
I agree. We've had so many times where families just, every time something comes up, you want to make sure you're sharing it. So you give them a call. Hey, just want to let you know.
Yes.
But being able to, like you said, respect them. Have a set time where the message is going to go out.
Right. And utilizing technology. Nowadays, there are so many different things that you can do to help keep your loved one safe. Even cameras in the home.
I love that idea. The life alerts.
Life alerts. So
alerts.
Yes, how many people have we ended up having in our care because they've fallen and laid there for a couple of days and no one knew about it?
Right. It's so scary. Just the other day, we had a gentleman, someone I meet with at the park, was home just working on his computer, and he got up to go get some water and tripped over his dog. And there wasn't anyone else in the house, and he didn't have a way to call for help, so he had to scoot. When you fall down, you're not supposed to move.
Yeah, I know.
And he decided to drag himself over, get up on a chair, and then roll his chair over to get some water, all before calling for help. Whereas if he'd had that life alert, someone would have been there immediately.
Yes. And there's a lot of different technology, even just for communication, WhatsApp, FaceTime.
Well, you talked about shared calendars. I think it's a great idea.
Yes.
It's being able, so everybody knows when there's an appointment. Everybody knows when medications are due.
Yes.
If there's issues where they need to take medications 3 times a day, that can even be set up on a calendar and everybody can be involved, or just those that need to know.
Right. And so we've talked about the nuts and bolts of this, but now it's dealing with the emotional aspects of care. And that's almost a lot harder because when you get people's emotions involved, there's no right or wrong or cut and dry. It's very individualized. So one of the things we always talk about is empathy and understanding each other's perspectives and who's coming at it from what angle and that type of thing.
I think it kind of takes me back in my mind. It takes me back to that maze we looked at the beginning. And when you're in the middle of this maze, everybody's walking into a maze with a different idea. Something that's going to be so much fun, something that's going to be easy, something they know. Some people think they know exactly how to get through it.
Right.
And then when you're in the middle of it, you realize it's not that easy. It's scary. You have to deal with guilt. There's so many positive and negative emotions, but mostly negative.
Right.
And there's not a shortcut.
No,
So being sensitive to where everybody's coming from and how they're dealing with this situation.
Yes, very true. And celebrating the small wins.
Oh, so important, Becky.
Acknowledge when something good has happened. Acknowledge when your loved one is helped out with something. Maybe the brother that is not really super involved has stepped up, and maybe the brother that lives in another state that has put everything on the eldest daughter has reached out and said, hey, I know I'm not involved, but I'm going to pay for mom's care, to have somebody come in and help out. Acknowledge it.
I agree. I think, too, those little things where, it's like I might not be there all the time, but I can be there on this weekend in, October. Why don't I come out and you take a break?
Yes.
Those little things that you can go out of your way and then acknowledge how appreciative you are. You didn't have to do this. I didn't expect it.
Right.
But thank you so much.
Thank you for doing it. Yeah, I agree. And then acknowledge the stress that's involved that everybody is going through. That's really important.
Right.
It's okay to reach out and ask for help. And this is something that we really are going to stress. How many times has somebody said, oh, do you need anything? And what's the answer?
No, everything's good. I got it.
I'm fine.
We're good.
So it's twofold. The first is asking for it, and the second is accepting it. And I read a story the other day that said, do not say to somebody, what can I do for you? Say, I'm going to the store and I'm picking up groceries for you. Send me your list. Or I think I told you I had a friend of mine that broke her ankle and was bedbound for a while.
Right.
And so I sent a cleaning person to her house.
I think that's so sensitive and so kind, because I know if you ask me if I need help, 99.9% of the time I'm going to say, no, I've got it, I'm okay.
Yes.
But I'll tell you, if someone shows up at my door and they've brought pizza, I'm going to invite them in and say, come on in, let's sit down. And I am going to so appreciate
Yes.
that they're at my house and that we're having pizza, that I have company. But so many people don't want to burden anybody.
They don't.
You know, and nobody wants to feel like that you're putting your own depressed feelings on someone else.
Right.
So being able to find a way to come alongside and just say, hey, I picked up some pizza, I'm coming by.
Right. And as the person that offers help, when something happens and one of my friends or loved ones is in crisis, you want to help them. It makes you feel better about what, it's for you too.
Right.
So I think that's something important, that if somebody is offering, it's not up to you to decide if they're being genuine or not. If they're offering, say yes
Right.
to whatever it is. And if somebody says, can I help you do anything? My mom is at home right now and I would love to go get a manicure and pedicure. Can you come and sit with her for 3 hours?
Yeah.
Figure out what you want,
And there
then
are people that
ask.
would absolutely love to have that time with mom.
Yes.
I know that I spent so much time with my grandparents, even my great-grandmother. After school, I'd run over to the house and, they were taking turns with great-grandma when she was in her late 90s, and I must have been 11, 12 years old. And my job was to dance around with a fancy, colorful skirt and do Mexican dancing. But my grandma would smile, my great-grandmother would smile, and that would be, and my mom, my grandparents would say, that's the only time we see her smile.
Right.
Was when that big, bright skirt was floating around. So those little things that people just appreciate.
Right.
And you have no idea.
And if you need to reach out to somebody, whether it's a therapist, a counselor, or a support group, there's other people that are going through what you are going through. And when you meet other people or talk to a professional and understand that what you're going through is normal and what you're feeling is normal, you might be feeling resentment and then feeling guilty about being resentful. But when you talk through those emotions and have other people talk to you about how they work through it, it's really important too. And there is respite care.
Respite care is great. If anybody's, if you're listening to this podcast, we want you to know there are lots of options for respite care. There are waivers, there are locations where you can take, group homes, assisted livings, and you can hire home care. Our Bright Star has people who hire us for respite time all the time. We can come in for a week or 2 weeks and just give you a break.
Right. And then we're going to go into the professional resources. So there are a lot of different options out there for professional resources. And one of the big ones is financial planning, getting a budget in place, understanding what that looks like.
There's the legal and medical planning,
Yes.
advanced directives, getting your your power of attorney for health care, power of attorney for finances, putting things into a trust, making sure that you know what's going to happen to your things if anything happens to you.
Right.
And not being afraid to do it.
Yes.
Not being afraid to ask for help. There is so much help. So many professionals out there, so many experts
Yes.
that want to help.
Yes. And now if you get into a situation where maybe your family cannot agree on anything and you are fighting and it is just devolving into chaos, there are professional organizations out there that can help you. And there's care managers, there's advocates, and we
Or
have,
if you're alone and you have no one.
if you are alone and you have no one. So today, why don't you do our introduction for who we're going to talk to about this?
Well, we want to introduce Rachel West with Nevada Advocates. And Rachel finds herself in situations like this all the time where families are struggling. There might be a client who needs help and doesn't know where to get it. Clients who just aren't able to call out and ask for help. And this is something Rachel deals with every day. She's a professional, she's an expert, she's a nurse. And I think we're going to go ahead and introduce Rachel West. Hi, Rachel.
Hi.
Welcome
Thank you
to
for
Bright
having me. I
Star Care
appreciate it.
Connections.
Yes. So, Rachel, you are an expert in this field and you know way more than we do. So why don't you just tell our audience a little bit about you and your background and what you do for families?
So my background is nursing. I'm a retired nurse. On staff, I have a registered nurse that's out in the field and an administrator in the office. I brought in a social worker several years ago to help us find the resources and things that clients need. Unfortunately, a lot of them are not easily accessible, and we were spending hours ourselves trying to find it. So we brought in the social worker to be able to expedite that, because sometimes it is an urgent situation where we need resources quickly. But a lot of the times, what we do are come in and like you were talking about with family dynamics, mediating between different children, stepchildren, husband and wife versus the children, and trying to decide what's best for their loved one. Like you said, everybody has a very strong opinion about that. And so a lot of the times, our job will be to buffer the situation between them, so that everybody feels like they're being heard, and help them kind of pull together to make that decision. Part of what our role is, as a case manager or as an advocate, is going in and help coordinating medical care. If it's a situation like you talked about, where they're really, even if the family is local, they just don't have the ability to attend those medical appointments. And honestly, sometimes parents don't want to listen to their children. Having a third party entity there that they consider, a professional versus a child that they raised, makes it a little bit better, where the parents may be more willing to listen to that person. So we'll coordinate their care. Often we bring in Bright Star or another agency to be able to work with them, because they're not really safe at home, or they need some additional assistance to be able to stay at home.
So, Rachel, how do people find somebody like you?
So with us, I mean, a lot of the times attorneys will refer people over. We'll have family members that go online and they're looking for help, and they'll search advocate or they'll search case manager, because maybe there's a complicated medical history going on right now, and they need somebody with a more medical knowledge, medical geared, to be able to step in and help guide them to the right specialist, or be able to work with them to figure out what to do with insurance or authorizations or things like that. And those are all things that we can step in and assist with.
And so, Rachel, what are like your top 3 tips that you would say for families that are navigating some of these tricky waters in healthcare and family dynamics?
So the first one, and it really hit home with what you guys were discussing as far as communication. You would be shocked how many times we meet with a senior and they say, "Oh, no, no, I have power of attorney in place. I've got my estate documents," but they've never actually spoken to the children that they've put in the position of making decisions for them. And when you talk to them and ask, have you talked to them about whether or not you want CPR, whether or not you want a feeding tube, you know, what are your feelings about hospice if and when that time comes? And it's shocking how many times, well, they just know. What, I mean, how do they know? Have you had that conversation?
Right.
And the answer invariably is no, they haven't spoken to them, and they just assume that their children know. When my aunt passed away about 10 years ago, it was really challenging dealing with the family, because as a case manager, I had spoken to my aunt, and I was her power of attorney as well, and had really had a very blunt conversation at least once a year with her about what CPR looked like. It's not Grey's Anatomy. They're not going to do 2 chest compressions, a couple of breaths, and you hop up and you're walking around. It's fairly traumatic when you have
Mhm.
CPR done, and just making sure she really understood what that was.
I hear
But it
people
was
break
interesting.
their ribs all the time.
Absolutely. And it was interesting, because when I spoke to my mother and my sister, their conversations with my aunt were very different. It was more, well, what are your wishes? What do you want? And my aunt took a much softer conversation with them, a much softer approach. And so when it came time to make decisions about hospice, it was challenging, because everybody thought they knew what she wanted, and nobody was really on the same page.
That's so true, Rachel. So, Rachel, I know that so oftentimes families, we've seen this in our own business, that you have siblings and step families that genuinely do not like one another, and they really can't even be in the same room together. So, do you almost act as a mediator between that?
We often do. We've actually had cases where there were restraining orders against the children, so they couldn't be in the same room, but they were both
Mhm.
POA for the parents and trying to make healthcare decisions. So often, what will happen is we'll meet with both independently so that they feel like they're being heard. We take all the information and the things that are important to them and what they feel like is important to their loved one. And then we try to find a path where there's a compromise between the two. And again, I mean, it's unfortunate, but a lot of the times people will listen to a third party entity because,
Mhm.
there isn't that sibling rivalry. There aren't hard feelings because I felt like mom favored you over me, or dad always took you to go on trips and I never got to go, or, whatever those emotions may be there that
Mhm.
they're dealing with in addition to a loved one that's ill.
That's a
And
really
so
good point.
yeah, they need that third party. Just like I said with the adults, often seniors, they don't want to listen to their children. Their children may be 50 years old now, but in that mom's mind or that dad's mind, they're still the little kids that took the car without
Right.
permission. They're still the ones
Right.
that, remember when you didn't pay your apartment, your
Right.
bill, and I had to step in and help you. So it's tough because getting them to recognize that they're adults and that they, you know, have their best interest at heart is sometimes challenging.
Well, Rachel, now we know why you're such an expert in your field, and we really
Mhm.
appreciate you stepping in and helping us out. And we will put your contact information on our website.
Absolutely. Thank you so much.
Thank you so
Thank
much. We really
you.
appreciate you.
Thank you, Rachel.
Thank-
That talking to Rachel reminded me that we brought on this Deciding Tomorrow Today. This is something that Nathan Adelson has put out, and I think it's extremely helpful in planning for well, exactly like it says, deciding tomorrow today. One of the scariest things to think about is the end of our life, and yet it's probably one of the most beautiful and precious parts of our life if we plan it that way. We're all going to have an end of life, and we get to decide how we're going to live it.
Yes.
That last chapter. So anyway, if you're interested, I know that we can get you a copy of this. Just give us a call, 702-982-2273, and we'll send you one of these Deciding Tomorrow Today. And then we also have, you want to tell them about?
This is understanding home care doesn't have to be hard, and it's a whole guide and charts and checklist and frequently asked questions about home care and what that looks like and conversations that you can have with your loved one. And this is on our website.
I love that it gives you tips.
Yes.
It gives you do this and do that, or don't do
Yes.
that, and it's really helpful because how many of us start off with the wrong thing and
Yes.
end up with our foot in our mouth?
Exactly.
Say hurt feelings or
Yes.
get our feelings hurt. And being able to have a few tips in dealing with family
Yes.
dynamics and loving and appreciating our families like we want to.
Right, right. So this was a great conversation as always. Our website is www.brightstarcare.com and look for the Las Vegas location. And this is our second episode, and we have probably 100 topics that we could talk about. There's so many different things. So
Right,
we'll be
right.
back in a few weeks to do another one. But please, that's it for our episode today. Remember to like, share, subscribe, and hit the notification bell on YouTube so you'll know when we release a new show. Also, leave us a comment and let us know how we're doing. And if you have anything that you are really wanting to learn about, or a guest that you would like to see, or if you have something that maybe you're an expert in the field and
Right,
you'd like to come
right.
and meet with us and talk with us, we'd love to have you.
Absolutely. And we'd like to hear your story. If you have a story about dealing with family dynamics or some of the challenges you've had with mom, dad, grandma, grandpa, even children. We work with children, adults, seniors, all ages, and we have so many stories, and sometimes they're going to be funny stories.
Yes.
So we'll have some laughter, some joy, and just have some funny stories. Do you remember that Dr. Seuss on aging? Mm-hmm. We'll have to read that to the rest of you one day.
Yes. But thank you, everyone, for tuning in. We really appreciate you for our second episode of Bright Star Care Connections. Have
And
a good
just
day.
again, like, share, subscribe, and hit the notification bell on YouTube. See you soon.